Thank you. Dr. Scott?
Good afternoon. I'm Dr. Nicole Alexander Scott, Director of the Rhode Island Department of Health, and I'm honored to be here with my esteemed colleagues, representative co-chairs of the Governor's Overdose Prevention and Intervention Task Force, the one and only Tom Coderre, and Dr. Brian Daly is representing on behalf of Director Rebecca Boss. Thank you for giving me the opportunity to say a few words about this important piece of legislation, particularly from a public health perspective. Since I stepped into this role 4 years ago, unfortunately, more than 1,000 people have lost their lives to accidental drug overdoses in Rhode Island. As we parse various policy proposals and discuss different data trends, it's important for us to pause and remember that behind every one of those unfortunate fatalities, there is a story. There's a family, and there is the tremendous anguish associated with the loss. These are people who are our brothers, our sisters, our co-workers, neighbors, and friends. They're people we've known for years through church or Little League or the PTO. And while there may be people that we can't bring back, we can honor them and love them as a community by doing everything we can to prevent any additional drug overdose deaths in Rhode Island. I want to emphasize the word prevent and use this piece of legislation to help highlight that drug overdose deaths are absolutely preventable. However, they're only preventable if we approach the disease of addiction as we would any other disease in the public health realm. That means following the data, following the science, and focusing on improving health outcomes for those populations that are most vulnerable. When we treat the issue of addiction as primarily a law enforcement matter, we push people farther and farther away from the help they need. We push people farther and farther away from the help they need when we charge someone with a felony for possessing a controlled substance in Schedules 1 through 5, and then put them in prison for up to 3 years. This kind of approach, which we've taken for decades across the country, has created striking race-based and class-based disparities in incarceration, while doing little to actually address the root causes of addiction. We have the opportunity to start doing things differently right now. The task force that I mentioned being honored to co-chair with my colleagues has helped to slowly change the trajectory of the drug overdose crisis in Rhode Island. And there's so much more work for us to do. We're finalizing our overdose death data for 2018, but we know that after seeing our drug overdose death totals increase steadily for more than a decade, we are now seeing a steady decline since 2016. This has been because of our strategic focuses on prevention, treatment, rescue, and recovery. Attorney General Narona's bill to make the possession of Scheduled 1 through 5 controlled substances misdemeanors will help us continue to move in the right direction. Law enforcement plays a critical role as a partner in Rhode Island's response to the drug overdose crisis. For that reason, Governor Raimondo's Overdose Prevention and Intervention Task Force includes representatives from law enforcement organizations on the local, state, and federal levels. But to prevent as many overdoses as possible and to save as many lives as possible, we need to strike the right balance and really engage from that public health perspective. You, the members of the General Assembly, have the chance to help us do that through this bill, as is mentioned, one of the important pieces of legislation that you can help push through. You've always been tremendous supporters of our overdose prevention work in Rhode Island, and I thank you in advance as we continue to ask for that support in helping us save lives in the state by ensuring that we treat the disease of addiction as the public health issue that it is. Thank you very much.
Thank you for your testimony. Senator McKinney.
Dr. Scott, thank you for coming and welcome. As always, your testimony is incisive. The written testimony that you've provided, I have only just received and taken a fairly quick glance at, but I find it fascinating, primarily because of the comparison with Portugal. And I guess my question to you is simply this: are there confounding factors, or are we really looking at an apples to apples comparison where Portugal took a different route 15 or so years ago and has had such a vastly different experience and has done so much better with their drug problem in that respect? And I don't know whether you might be able to address that.
Yeah, what I would say is, given the difference in time frame, Portugal certainly has had, the 15 years to be able to learn and gain from the approach that they have taken. I wouldn't say that they are apples to apples, but it certainly gives us a model to be able to follow after. This is an approach that the AG has put before us that is one that we certainly support. We also have seen from our own history that the criminalization approach has not worked effectively, has led to more disparities, and has not saved lives. So we want to balance what we can gain from Portugal and apply that to our state and country in a way that will be most effective.
Thank you.
Any other questions or comments for Dr. Alexander Scott?